On today's episode of Plastic Surgery Uncensored, Dr. Radi Rahban will tell you exactly why he became a plastic surgeon, why he is so passionate about making sure that his patients are informed, and why he's out here in Beverly Hills, the mecca of makeovers, trying to right the wrongs before they become really wrong. Hi, I'm Monique Marvez, writer, performer, air talent, here with board-certified Beverly Hills plastic surgeon Dr. Radi Rahban, and we are launching, I'm very excited about this, Plastic Surgery Uncensored. Now, I have to ask, is Radi short for something?
Well, it's not really short. It's a long story. That's what happens when you have ethnic parents. It's actually Sharad is my first name.
Wow.
Radi is my middle name. And Radi is a truncated version of Sharad. Radi is the nickname. But I've gone by Radi since I was, 3, 2, something like that.
So I'm guessing your parents weren't from Brooklyn.
No. The east side.
Where were
east
they?
Side of Iran. From Tehran in Iran.
And I'm asking because it's so interesting. When I first met you, you spoke to me in English and Spanish.
Yeah.
And I like that you care about diversity. But let me not get ahead of myself. We're here with Dr. Radi Rahban in Beverly Hills. You are a board-certified plastic surgeon.
Correct.
Right here in Beverly Hills.
Right here, right in the middle of, as I refer to, the eye of the hurricane.
The eye of the hurricane. This is the epicenter, the mecca of changing your face.
Sure.
The mecca of makeovers, if you will.
Indeed.
Beautiful. Now, my question is, why a podcast? Here you are. Clearly, you're in an exclusive place, a board-certified plastic surgeon, this beautiful Hollywood Regency office, and yet a podcast? Why?
Well, the reason is, I've been in practice almost 15 years, and I've been really blessed in that during this journey, I've had an opportunity to take care of hundreds of thousands of patients. And in that process, my practice slowly morphed over time, and little by little, I started to see sort of an influx, more and more of revisional type cases. Revisional meaning people who had a breast dog and it didn't go well, a mommy makeover, and they were unhappy. And so what slowly happened to me as a practitioner is I started finding myself constantly trying to educate these patients. And then as I started to see all these revisions, it started to change the way I saw primaries. In other words, as I saw all these patients coming in from all over the country, now all over the world with complications, it started to change the way that I communicate with my primary or patients coming in for the first time. And I spent so much time every day trying to educate patients on how to navigate this whole process. Plastic surgery can be, it's like it's a double-edged sword.
Mm-hmm.
It can be the most amazing thing you've ever done. It can be simultaneously worst thing you ever decided to do. And so the question then becomes, as is for everybody, patients, how the hell do I decide? How do I make sure that I fall on the right side of that fence? And so what I do every day is one by one, patient by patient, I tell them the specifics of how to get through this process, how to avoid becoming a statistic. And so when you do this on a daily basis, patient by patient, you start to realize like, holy shit, I really need to get this message out. And so that's when I decided, you know what, I think a podcast is a perfect platform in order to get the message out about plastic surgery. And the message being not that plastic surgery isn't safe or isn't good, but there is a right way and a wrong way. And that if you know, like it is with every other decision in life, how to do things the right way, you should end up having an outstanding outcome. And that's what I want for patients. I want patients to do well.
So there's a lot of misinformation. There's a lot of outright false information out there, is what you're saying.
Yeah, I think it's a multitude of things. I think one is people, it's complex, and I know that patients feel like it's being demystified. It's really not being demystified. It's being dumbed down because, the cosmetic world wants patients to think it's no big deal so that they're more likely to do. So one is that people are under the impressions it's not a big deal. So they're misinformed in that regard. Some of the information that they're getting is just flat out inaccurate, right? They're biased. So like you go on a website and the information there is not right. And then there's a ton of crap now with social media and Instagram and Facebook. So there's like a million sources of information coming into an average patient. And it's just, to be honest, it's very difficult to figure out truth from fiction.
And you found yourself repeating in very broad strokes the same things over and over to your primaries. Is that basically what you want to do now, is give like the basic, let's say the ABCs of plastic surgery, so that when somebody comes to you, maybe they've already looked this up and listened to this podcast, and you could tell them this is a very basic thing you need to know or not know. It seems that what you're saying is You were repeating yourself a lot for your primaries, and you want to put that information out there accurately and correctly.
Yeah, I mean, listen, I feel like I'm like the David Horowitz meets the Geraldo meets the, I feel like somebody, don't get me wrong, I'm obviously not the only guy that does this, but I think there's a handful of really passionate plastic surgeons who want to help their patients do what it is that we do, which is get great outcomes. And we live in an amazing time, right? We have access to all these new technologies. So like everything, like a nuclear bomb, it can be used for good and it can be used for bad. And I want to use all this technology, i.e. a podcast, for benefit, right? Because I think that for the most part, most of the stuff is garbage. I think the Instagram accounts, if you really sat down and looked at them, they're ridiculous. I think the Facebook and some of the videos, and it's just becomes more and more and more scandalous. And I think this is an opportunity for us to reverse it a little bit and bring a little bit of honor back to plastic surgery and bring a little bit of respect, because at the end of the day, it was a profession that was at one point very highly respected. Now I almost feel like if people ask me, oh, what do you do? I'm like, I'm a doctor. Oh, wow. What kind of doctor? I'm a surgeon. What kind of surgeon? Like I'm almost embarrassed to tell people I'm a plastic surgeon, because when I say I'm a plastic surgeon, whether you like it or not, you have this image and this vision, and you automatically think of Hollywood and, glitz and glam and all that garbage. And that's not the reality of the profession.
You're lumped in with the guys with less ethics, or what you're basically saying. There's a lot of people that don't have your ethics.
Well, there's just a lot of people that are doing it differently.
Okay.
And
fair
at the
enough.
end of the day, I'm here not to talk about myself as much as I am trying to, I'm trying to get information out to the masses, because plastic surgery is not going anywhere. It's growing by the minute, as I think it should, because I think it's amazing. And I just wish that people would do it the right way rather than the wrong way. And so I want to get the message out. That's really the bottom line.
So before, you were a little bit embarrassed to tell people what you did. You are clearly very passionate. When did you decide to be a plastic surgeon versus another type of doctor?
I think, I always knew, when I was in elementary school, I was always good at arts and crafts and things of that nature, which I think people intuitively think plastic surgeons are artistic. I would say maybe 15% of them really are. The rest just are not. So I was always very good at art and things of that nature. And then I got into college and I was good at science. I wasn't very good at the liberal arts and things of that nature. And at first I wanted to be an architect. And I love design. I designed this office. I designed my home. I love photography. And I love all those kind of things. And I wanted to be an architect. And I went and talked to a few architects. And as do most professionals, they complained and said how terrible their lives were. And it kind of like shifted gears. And then I had gone to college. And when I was in college, I was a biochemistry major, and I knew that I wanted to do something in the sciences, but at the same time, I was like, well, what the hell am I going to do in the sciences that's even remotely artistic? I mean, cardiology doesn't really have much art to it.
No.
If you're a nephrologist, it's not very.
No, a kidney's not pretty.
Nah, it's pretty, but it's really got one shape. And then so ultimately, I had an opportunity to shadow this plastic surgeon in my thing, and it was like the way people, I imagine, describe it when you see your child come out of your wife's belly. It's like you have instant love. And so I watched a rhinoplasty and I was like blown away. You either pass out or you're inspired. It's one of those pivotal moments. And I was like, wow, this is incredible. And so I pretty much decided I want to be a plastic surgeon very early on in college. And then I never looked back, and I just pretty much just been on that track for a very long time.
Very good plastic surgery borders on the magic. It really does. It borders on the magical. Yeah. It's got a little bit of a mystical element to it. And we talked a lot about training before we sat. You and I have talked. And, training is one of those things that I think people need to know immediately. Is there you're a board certified plastic surgeon?
Correct. Yeah.
What does board certified mean?
So I have a lot of pet peeves. People who know me know that I have a lot of pet peeves, and I get irked very easily because I'm bothered by all of the BS. And so, listen, if you go and ask even my own patients and you say, okay, well, you love Dr. Raban. He's amazing. He did a great job. What school did he go to? Crickets. No idea. Where did he graduate from? No one really knows. And unfortunately, no one gives a shit. What people care about is how many followers you have on Instagram. People care about who the celebrity that endorsed you is. And so we've really we're way off track on this, because while training isn't everything, in other words, if you're a Harvard graduate, it doesn't automatically make you better than some other, but training is invaluable. And so the problem that we have today, and I think there's a whole movement, I don't know how well it's going to take, but there should be a movement of transparency. That's what's one of my biggest pet peeves, transparency. So the problem is cosmetic surgery is the most confusing area of all of medicine. When you go to
I agree.
When you go to your doctor with a brain tumor, they're a neurosurgeon. That's it. You don't ask questions. They're a neurosurgeon. Who else would be doing it? But when you go to get a breast aug, the question you would have to ask is, what kind of doctor are you? The general public thinks that everyone's a plastic surgeon. Why? Because that's the lingo that everybody uses. But the truth of the matter is today, that is hardly the case. I mean, hardly the case.
Really?
So what you have is you have alphabet soup. So you have the
alphabet soup.
So you have all these words, right?
Okay.
You have plastic surgery and cosmetic surgery.
What's the difference? I thought they were the same thing.
I know,
thought
but
they were synonyms.
No, they're not. They used to be synonyms, but now there's a whole world of confusion. So let me give you this. Let me break it down for you.
Okay.
So when I went to medical school and then I went to residency. Residency was when I got my training. I trained in plastic surgery. Somebody else trained in OBGYN. Somebody else trained in head and neck surgery. Somebody else trained in orthopedics. There are specialties that are approved by the ACGME, which is the overriding body. Then when I finished, I went into private practice. So I became a plastic surgeon. Then I went and got board certified. So the first thing you need to know is once you graduate, it doesn't necessarily mean you're board certified. That's another higher level of testing that says that you know what you're doing. So you have board certified plastic surgeons. I like to refer to them as the lions in the jungle. Then you have plastic surgeons that never went and got board certified.
Whoa. So it's not like the bar? You don't have to be board certified to practice?
Not at all.
Okay. There's a lot of people that wouldn't.
No, of course not.
So there's unboard certified
No,
plastic
you have a medical license, which would be the equivalency of being a bar. So you have a medical license.
Okay.
So you passed the bar, you got your license to practice law, and you've the same thing with law. This is saying that you've passed certain certifications that make you even more well trained. So you have board certified plastic surgeons. Then you have plastic surgeons who never got board certified.
Okay.
Which is fine, but then you have to ask yourself, why not? Right.
That's the question.
And then you have this whole other world. And this whole other world collectively is called cosmetic surgeons. And in that whole other world fall the following surgeons.
Okay.
So you have ENTs, ear, nose, and throat, doctors who get additional training and become facial plastic surgeons. In other words, they are ENTs that do cosmetic surgery of your face, right? So nose jobs, facelifts. So you can get it done by a plastic surgeon or a facial plastic surgeon. The problem is that's not the problem. The problem is they're trained and that's fine. The problem is many of them drop the word facial and they call themselves plastic surgeons who like to specialize in the head and neck. And many of the ENTs do breast augs.
I was just going to say, do they slide out of their field? Isn't it the most natural?
So what ends up, the problem right now is that everyone is cross-pollinating. Why? Everyone needs to know what is the reason for things. Why are people migrating from Guatemala to America? Because their quality of life there sucks. That's why they're leaving.
Sure.
Why are people leaving, their specialties going elsewhere? Because healthcare has changed a lot. Reimbursements are terrible and doctors are moving towards specialties that they feel are going to be more lucrative. Let's start with that.
Okay.
So what happens is the ENTs, if they were doing just their cosmetics of their head and neck, well, they're trained to do that. But when they start doing boob jobs and tummy tucks and lipo, we got a problem. So those guys are facial plastics, drop the facial, are plastic surgeons that do blah, blah, blah. Then you have oculoplastics. Those are ophthalmologists who do eyelid surgery and cosmetics of the eyelid. They drop the word oculoplastics. Then you have dermatologists doing facelifts. Then you have
dermatologists doing facelifts?
Correct. Dermatologists doing facelifts. Then you have OBGYNs doing tummy tucks. You have orthopedists doing liposuction. So what has happened is all of these people call themselves cosmetic surgeons. So there is no cosmetic surgery school, not like orthopedics and OBGYN. There's no training program. So
there's no board certification in cosmetic surgery.
No.
It doesn't exist.
No. So what happens is They collectively call themselves cosmetic surgeons. And this is a huge, huge group of people. And they created their own meetings and they created their own fellowships and training, and they're trying to legitimize it. And again, I'm not here to say what's right and wrong.
Can I say it? That
No.
sounds like a shortcut.
Well, it is what it is. I'm not here to even say that. Let's say there's a guy who's a cosmetic surgeon. She's an OBGYN that does tummy tucks. And let's just say, for the sake of this discussion,
Sure.
she's amazing.
Okay.
Like her results are unbelievable. Okay. The question and the issue is not that whether or not she should or shouldn't do that. That's not for me to decide. That's for the, people think there's this umbrella, arching umbrella, big brother. There is no big brother. The government doesn't know it. There's no one is supervising this, just FYI. The only issue I have, which is a big one, is transparency. When you go to that doctor's website, they're going to say they're a board certified cosmetic surgeon. So listen carefully. That means they are board certified in OBGYN and they're practicing cosmetic surgery. Do you see how that is very misleading?
Yes.
So again, transparency. If you're an OBGYN and you got additional training and you're doing tummy tucks, your patients should know that. And the question is,
100%.
well, what the problem is, patients are, the argument is, well, they need to look. But then you have to really scour. And so I think what we need to do is we need to make it so that when you walk into a doctor's office, their training is like forced into your face. Like, I am certified by so-and-so and so-and-so. So at any rate, I don't even know how I digress, but I am a plastic surgeon and I am board certified and I'm board certified in plastic surgery. So,
And my question, okay, so where did you go to school?
I did my undergrad. I've been a Southern California boy all my life. So I did my undergrad at UCLA. I did my medical school at UCSD. I did my general surgery and plastic surgery residencies at USC. So, I covered all the ground of Southern California.
So you've been in the mecca of makeovers since day one.
Yeah.
You've seen it all.
And I went to a high school at Beverly Hills High School. So I'm a local boy.
It doesn't get any fancier.
Yeah, it's real fancy.
You were surrounded by nose jobs from day one.
Yes, that's true.
Yeah,
That's
I
very
can
true.
only imagine your high school class,
Yes.
what they look like, with the before and afters.
Correct.
Do they look better now in their high school graduation pictures?
Unfortunately, they not so much.
All right. Well, one of the things, you're a Southern California boy, but and you speak Spanish, which I mentioned earlier. But one of the things that I really loved about you is that when we talked about beauty, you are sensitive to the fact that different cultures have different ideals of beauty. We talked extensively about this nose versus that nose, or I'd like you to elaborate a little bit, because you're saying that within the Asian American, African American, Latinos, and Middle Eastern, or I don't even know if you say Middle Eastern American, that they're sort of being homogenized or told this is pretty and this isn't pretty, and you're not about that.
Well, I just think the problem in general with plastic surgery, it's an art form, right? So
Sure.
who's to say that you like abstract art versus contemporary art? It's not for me to decide. I have my own aesthetics and I have my own taste. And I have found that when people come and say, oh my God, Dr. Raban, your work is so amazing. It's so natural, right? We love the word natural. What the hell is natural? What makes something natural or unnatural? And what it really comes down to is recognizability. So when something starts to look unnatural, it's when the normal features start to disappear. So when you're African American and you have African American features, and then all of a sudden those features are obliterated.
And how does that, is it a thinning of the nose? Is it a changing?
So for example, I'll give you a perfect example. One thing that is, we talk about ethnic diversity, is rhinoplasty, right?
Okay,
So
yeah.
a nose really defines people, right? An African-American nose is different than a Middle Eastern nose, is different than an Asian nose, correct?
Yeah.
And so when you do a rhinoplasty, which is one of my specialties, if you get too extreme or overdo it, you're going to notice that the features that make somebody African-American, let's say the nostrils are a little wider and they'd like to make them a little smaller. Okay, understood. But if you make them really narrow, they're going to look like many of the celebrities that we know that we would use as examples, which I'll refrain from, that look classically overdone or done. When someone says African-American bad rhinoplasty, everyone has an image in their mind. Why is that everybody unanimously thinks of the same people? It's because those images are not reflective of a natural looking nose in that ethnic group. And so I think the key is not, there's no formula. There's no formula to beautiful art. There's no formula to beautiful music. It's just something makes sense and something doesn't. for me personally, I've come to realize, they're saying less is more. Overdoing things, the extreme nature of things tends to almost invariably make things look ethnically incongruent. So my philosophy is less is more, and try to keep people looking balanced rather than overdone. That's really what it comes down to.
And again, and I'm just going to tell you personally,
Yeah.
I had a nose job many, many, many years ago in Miami, and I told him that I didn't want to not look like me. The issue was that, my profile was quite flat. And I said, whenever I turned my face on camera, I was just starting to do stand-up. I said, I look like a cat. Face on, it looks good. I turn sideways, it's, like a cat. But I was adamant with him. I want to look like me. And the funny thing is, my whole family complained and said, you threw away your money. You look the same.
Yeah.
But I felt like I wanted that.
Yeah, and
I still look Latina.
Yeah,
I don't have a little
totally.
apple seed nostrils and a little ski jump. I don't.
It's totally, and I think the problem, one of the biggest challenges in plastic surgery is this idea that someone comes to you with an idea,
with a dream.
With
Let's just call it what it is.
No, but with an idea of what they want.
Yeah.
And they're using a bunch of adjectives to describe to you what they want, and then you're supposed to produce it. So it gives them, I want to look cute. I want to look pretty. I want to look natural. I want to look like myself. We all think we know what that means, but it all means something slightly different to everybody. And so the danger, and I never, ever allow patients to communicate to me with adjectives. I want to look cute. I don't know what that means, ma'am. I want to look pretty. Haven't got a clue. How about natural? No idea. You have to speak to me in specifics. Engineering. You don't say to an engineer, hey, make that building a little bigger. Well, bigger what? You mean 2 meters? What? So, the danger, what's lost in translation today is that doctors don't care, or that's a big phrase. Doctors don't have the time nor the energy or the want to sit down and actually decode the conversation. Patient X comes in, they have this idea. They describe a bunch of general terms. Doctor says, got it, sure, you're going to look great. Okay. Then all of a sudden, and in his mind, he's got what he thinks, and all of a sudden, poof, that's what it is. Well, what if you don't like it? Or what if you don't think that looks natural or pretty or cute? So I am very particular about the consultation process, and we spend a ton of time on languaging. So when patients say things like that, I force them, and you'll be shocked how many patients are uncomfortable with me being like, okay, I don't know what that means. Now describe it to me in specifics.
And what do you think causes the discomfort?
Well, because they've never actually thought about it. They've never actually broken down into I'm like, so is it the hump specifically? Is it your nostril is 3 millimeters too wide? Is it your tip is bulbous? Oh, yeah, let me look in the mirror. And so what happens is that really makes sure that she and I are on the same page, or he and I are on the same page.
And
I think that's
you have
really
them
important.
Describe it.
Yes, as opposed to using adjectives.
It's funny you should say that, because I was probably a good patient. I was 21, and I went in and I, turned my head in many directions so he could see. And I said, I just want a little more profile. And this was in the 80s, and you'll probably be horrified. He took a piece of cartilage out of the back of my ear.
No, we do that all. I do that every.
You can still feel the little piece that's missing.
Yeah.
And put it on the tip of my nose.
Yeah, we do that. That's good.
I'm
You're happy, right?
I'm delighted.
Okay.
Beautiful.
That's what matters.
Now, you were mentioning earlier that a lot of people come to you from around the world, and you even said you've been doing this 15 years. How much of your practice do you think is revisions? People that just didn't get all the information, didn't describe properly, are there doctors, I'm just going to say it, that are somewhat of mills? They don't care about the description because they have one way of doing things. There was a doctor in Miami, we knew when somebody got a nose by him because everybody's nose looked the same. It was like the Rachel haircut. So,
yeah, I mean, I think my practice, unfortunately, has progressively become more revisional. When I first started, it wasn't that way. And now I would say probably at least a third of my practice is revisional.
Wow, a third.
Yeah, a third.
When we come back, can we talk more revisions?
Absolutely.
You are listening to Plastic Surgery Uncensored with Dr. Radi Raban on Revolver Podcast. An enormous part of Dr. Radi Raban's practice is revising other doctors' work. Over 30%, he said. Just like an artist, a clean canvas is the very best way to start. But unfortunately, when a patient has had a bad result, the doctor does not have the luxury. He has to get in there on a canvas that's already been compromised. And Dr. Raban has to correct and perfect. I was absolutely stunned, Dr. Raban, to hear what percentage of your practice was revisions. A third.
Yeah, a third.
That's
and
a
in
lot.
that third, it comes in all facets of plastic surgery. Noses, and I do a ton of revisional breasts or terrible liposuction or awful scars or things of that nature. And the reason for it is that it's a craft. It's an art form. I use the analogy and I say, look, for example, my breast lift with implant takes me about 5 hours.
Wow.
5 hours. So the standard breast lift and implant in the US is probably 2.5, 3 hours. So you ask yourself, I'm a fast talker and I'm a fast operator, but you cannot speed up detail. So if I said to you, I want you to make me a flan cake, but you only have 4 minutes to make it, how good would that flan be? If I said to you, I want you to paint me a mural, but I need you to do it in 13 minutes. So the reality is, if you take a look at anything creative, music, art, food, but then you speed it up in that process, the details, the specificity of it, the accuracy of it is lost. And so surgery is like anything else. And what ends up happening is there's a cost-benefit analysis. So, I always use the analogy of Hermes versus Coach. Not that I care about brands, but I think it really explains to people. You buy an Hermes bag, the stitching, the leather, the base, they're both bags. The Coach bag, the Hermes bag, they do the same thing. So I say if a patient wants to have skin removed, I'm probably overkill. If a patient is into details, the size of their areolas, how thin the scar is, the symmetry, the shape, the little nuances, well, that doesn't happen accidentally. That happens by intention. So a breast lift with implant, if you want the two breasts to actually be really symmetrical, you want the scars to be really thin and become invisible, you want the areolas to match, how the hell can I do that in 2.5 hours? I cannot. I physically cannot. So I don't have my tech clothes. I can't rush it. So what's happened is it's become more and more of a business model, and time is money in surgery. In other words, if I do something in 5 hours and I do the same exact thing in 2.5 hours, well, I just saved 2.5 hours worth of operating costs and money. I make more money, but we both know that that's impossible. So, I do a ton more revisions, and the revisions is where this whole frustration initiated from. You know what I mean? Let's say you have the secret, and you have to tell people one at a time, hey, by the way, you'll get crazy after a while. You want to get the message out. Hey, be careful. Hey, watch out for that pothole. Hey, watch out for that pothole. So that's where we are. I'm trying to tell people about the pothole.
Beautiful. Now, earlier when you and I were talking, you also said that you turn people away. Now, talk about a cost model. I'm sure there's some doctors that don't turn anyone away, that are whatever you ask, they're like, yeah, we can get that done. And you actually said you turn people away.
Well, of course I turn people away.
It's not an of course, Dr. Raban. That's not an of course.
For us, it's an of course. And because the reality is you think about it. Not every single person who's sitting at home who decides, wow, I really need to change something about myself, who walks through the door is right. They're just not. The fact that you walk through my door doesn't mean you're a candidate, right? The fact that you sat at home and you looked at your nose or you looked at your belly or you didn't like your ears or whatever, and then you came here and you said to me, hey, by the way, Dr. Raban, could you? So that is at the discretion of the professional. Professional meaning your doctor. Your doctor needs to be able to decipher if the needs and wants that you have are actually reasonable and doable. So those are totally different things. Reasonable means like, yeah, I can see that. I can see what you're talking about. Doable is, okay, I see what you're talking about. Now I can actually execute that. Because the problem is there's two reasons why doctors are over-operating. Two reasons.
Okay.
Greed, AKA, listen, I have a heavy-duty rent. I've had 4 divorces. I have a boat I need to pay for. Whatever.
Yeah.
So I need the money. Or ego. I can do this. Your 4-time revisional nose. Those guys didn't know what they were doing.
Whoa.
I'm going to fix this. So for me,
they sound equally dangerous, by the way. I was going to say that greed was worse, but once you described ego, that kind of got scary.
Well, that's the cocktail for disaster. And that's why these numbers are going sky high. Because doctors are beginning to think they're better than they are, which we already know doctors have a little tendency towards that. Mm-hmm. And greed, at the end of the day, drives almost everybody in the world. So for me, the idea is you come in, I take a look at you, and then I ask myself, do I really feel that I can make you better? Can I hit it out of the park? Not can I get a first base and you're going to look mildly improved, not a lateral movement where you look different but not better. Can I hit it out of the park? And if I think I can hit it out of the park, then I'm going to consider it. So what are the reasons I won't operate on you? Well, number one, you are looking at something the wrong way. In other words, you think you have something wrong with you when in reality, I don't really see it. And that happens. I've had beautiful young girls come to my office with beautiful noses, maybe a tiny little hump, or gorgeous breasts that they want just a little bit bigger. And I'm like, no, I just don't see what you see. In other words, I don't see it the way you do. If someone told you, and me and you walked outside and they're like, look at the sky, it's so green. And you're like, green? No, it's blue. What are you talking about? So if I don't see what you see, I can't operate on you. That's number one. Secondly, you're just not a good candidate. Like, you'll come in, you're 5'2", and I told you this earlier. You're 5'2" and you weigh 185 pounds. Okay, no problem. And I want a tummy tuck. Can't help you.
Too much tummy.
Can't help you.
Can't tuck it.
Can't help you. You need to go lose 40 pounds and you need to come back, and then I can hit it out of the park. And so you need to, every surgeon will have their own internal barometer. You would hope and you would think that we, meaning us doctors, would be holding ourselves to a higher level, and we would be like you would expect from clergy and from teachers and from firemen and from police officers, sort of have a higher level of integrity where we would do the right thing. But we know that that isn't the case. And so where does the onus fall? On the patient. The onus falls on the patients, because those days where you could just walk in and say, hey, doctor, what do you think? Can you help me? Those are gone. That doesn't exist. I'm sorry to tell you that. You have to watch your own back, and you got to do the homework. That's it.
I'm going to push a couple of buttons in you. Earlier we were talking about some things that really drive you crazy, and you mentioned some pet peeves earlier, but I'm going to throw the word out there. Like the Cooper, mini. The word mini sends you right.
My favorite word, mini.
Yeah, let's just dish.
So I mean, it's this notion, and the frustration is it
a real thing?
No. So what it bothers me, what is mini? Mini is a term that is put as an adjective. You can see I'm anti-adjectives. Is the adjective that doctors use to make reference to surgeries to minimize or make seem less invasive for patients. Mini facelift, mini tummy tuck, mini this, mini that, lunchtime this, lunchtime that. Where did all this crap come from? It came from the fact that as a community, it's competitive. And so what doctors started to realize is that patients were afraid of facelifts, like either afraid or were insulted that they needed a facelift. And so if I threw the word mini in front of it, you'd be more apt to do a facelift, because you're not getting a facelift. You're getting a mini facelift. I'm not getting a tummy tuck. Oh, no, I don't. I'm getting a mini tuck. It's all garbage. It's all adjectives that are used in order. Now, there are instances, yes, where someone does need they're 50 instead of 80 and they need a facelift that's less invasive. So I'm not saying that the word in of itself is completely off limits. I'm just saying that it's being overused. And so what it actually stems from, and what really irks me, is the manipulation in the marketing that's being done to draw in patients. So it would be the equivalency of a ice cream truck that has all kinds of nice pictures of famous Disney characters and very nice Disney music, but inside is a pedophile. It's drawing in and manipulating children. And when they sell e-cigarettes to kids, they put them in bubblegum flavors.
Yeah.
So they are targeting unsuspecting people. That's what pisses me off. Because the reality is you're having a facelift. And with a facelift comes facelift risks, facelift downsides.
People die in facelifts.
And facelift downtimes.
Yeah.
So this idea that I'm going to get a mini lift and I'm going to have it done and I'm going to be back to work on Tuesday, it's a nonsense.
It's a big surgery. It's a big surgery.
So hence why I get
There's nothing mini about
I get a little testing.
Having your face cut into.
Yes.
And I'm going to throw the phrase out, Dr. Google.
So Dr. Google is a phrase.
Look at that face. Yeah. Look at the face he made.
They can't see my face. It's podcast, so you'll just have to describe my nostril flaring. Dr. Google is the new phenomenon. So we went from having no information as patients to having too much information as patients, right?
Dangerous.
You went from walking in and not knowing anything about procedures and sort of being super naive at, like, let's say in the 80s, to now everyone thinks they know everything about everything. So watch a few YouTubes, do a little podcast, check out a couple of websites, a few vlogs, and boom, I'm an expert. So when a patient comes to me and they say, hey, how can I help you? What's going on? And they say, oh, I'm here. I need a Anchor massopexy with a superior medial pedicle with a 325cc silicone implant moderate profile. I'm thinking to myself, like, oh, okay, well.
Is that English? Did you just speak English?
That was doctor talk.
Okay.
I'm thinking to myself, okay, well, good luck. Because what happens is you go online and now you have all this information in your head. And the reality is that shouldn't have been the conversation. The conversation should have gone something as follows. Hi, doctor, how are you? You know, I've had several children and I breastfed a lot. And, you know, my breasts have changed since that time. And I've lost a little bit of volume and my breasts are a little saggy. And I don't really like the way they look. And I'd love for them to be a little bit more youthful, maybe a little perky. What do you suggest? And then we start a dialogue.
Okay.
And it's, you know, it's neither paternalistic, AKA, I know better, you don't know what you're talking about. Those days are gone.
Mm-hmm.
Nor patient knows best. I'm here to serve. I'm your Uber driver. Tell me where you want to go. I'll do it. It's collaborative. This is collaborative medicine. So you come and tell me what's wrong with you. And then your doctor better know how to explain to you what he or she thinks is wrong, what your options are, and what they suggest. If they're not capable of doing that, then you got a problem. But you walking in and saying, I want X, and them giving it to you is a catastrophe.
Okay, so we'll have a practice one. Hello, Dr. Raban. My name
Hi.
is Monique Marvez.
Hi, Monique.
I'm a comedian, air talent, writer, performer, and I have 3 Showtime specials. I'm gearing up for my 4th one, and I've lost quite a bit of weight. I've lost some volume. I had some implants put in the 90s. I would like, you know, in the parlance of our day, a hooter hike. I want them, just like you said, I want them more youthful. I want them in the right place. What would you suggest? Like, was that good? Did I do that well?
That was good. You're excellent. You learn well.
Yeah, well, I paid attention.
Yeah, so yes, and then what would happen is I'd ask you a bunch of questions.
Uh-huh.
And then I'd examine you. And then I'd sit down and say, okay, Monique, well, here's what's going on.
Mm-hmm.
These are your options.
Mm-hmm.
Not this is what you need. These are your options, but this is the option that I think is best for you. And this is why. And here are the risks. And this is what it's going to take to recover. Now go think about it. That's the conversation goes. It doesn't go that way. It goes, I want my breast bigger, fuller, whatever. I think I need a bigger implant. Yeah, okay, sure, I agree. We can do that for you. Done. It sounds ridiculous. Like I'm being sort of sensational for the sake of No, that's actually how it's happening. If anything, doctor's not even seeing the patients. Many times the coordinator or the office consultant sees them.
100%. I've seen it.
My consult's an hour. 1 hour. 1 hour of my time. Consults are like 20 minutes.
Yeah.
How can we talk about anything in 20 minutes? So I think that's really, really, really important.
Beautiful. Well, then that means that we have wrapped up our very first episode, our maiden voyage, if you will, of Plastic Surgery Uncensored with Dr. Radi Raban.
It's a pleasure. I'm excited. I think we have a lot of good to do ahead of us.
If you loved Plastic Surgery Uncensored, and I'm sure you did, I don't even want to say if, we would love to get your feedback. If you enjoyed and found our podcast helpful, tell us why. Give us a review and subscribe on your favorite podcast platform. We can be found on Apple Podcasts, Google Podcasts, Spotify, iHeart, or you can go directly to revolverpodcast.com. If you have a topic you would like us to talk about, then please reach out to us on Facebook, Radi Raban, Instagram at Dr. Radi Raban, or RadiRaban.com. You are listening to Plastic Surgery Uncensored with Dr. Radi Raban on Revolver Podcast.